LSVT LOUD is a speech and voice program that was specifically designed for patients with Parkinson's disease. It's named for Lee Silverman. LSVT stands for Lee Silverman Voice Treatment. And Lee Silverman was this kind lady who agreed to take part in the program as their initial patient when Dr. Cynthia Fox and Dr. Lori Ramey were developing this program. So they named the program for her. They've been developing the program and honing it and tweaking it for over 25 years. So they continue to do research all the time. Patients with Parkinson's disease oftentimes will notice changes in their voice and in their speech. And so some of the things that we see are things like low vocal volume or monotone voice. Oftentimes these patients will mumble or speak very, very quickly so you can't understand what they're saying. Unfortunately, due to the Parkinson's disease, they perceive that their voice is still normal, so they don't often realize that other people can't understand them until their families are telling them, "I can't hear what you're saying," or "I didn't understand. Can you say that again for me?" For me, what makes it unique is that there's so much research that has gone into it. The speech-language pathologists that I mentioned before, Dr. Ramey and Dr. Fox, they developed the program on their own and they've done research to back it up. And they looked at so many different ways to do the program. Like, should we do it twice a week? Do we do it 3 times a week? Do we do it for 6 months? You know, they kind of looked at all these different ways, used clinical research to determine what was the best way to deliver the program. And one of the things that also makes it unique to me is that they continue to do research today. And then as a trained or certified LSVT LOUD clinician, I'm required to do certification renewal every 2 years and keep up with what their current research is. When we get an order from a physician to see a patient, they come in for a full voice evaluation, and during that evaluation, we look at what they can do with their voice. How loud are they when they're just talking in a conversation with us, or when they're talking about something in their life that's interesting to them. And so we record the voice and get an idea of what their volume is, and then we do some exercises to see, can they be a little louder? Are they a good candidate for what we have to offer? We meet 4 times a week for 4 weeks, and each treatment session is about an hour, and we go through a whole series of exercises that are specifically designed for the LSVT LOUD program. So we work on things like stretching out a vowel for as long and loud as you can, reciting some functional phrases, things you would say every day, like good morning, is it time for my medicine, did you let the dog out, things like that. And it all has this underlying theme of be loud, and kind of getting that in the head, you know, for everything you say, you need to be loud. You have to do some exercises at home. And the exercises are sort of a mini session. So the same exercises that we do in the clinic, then the patients are expected to do at home. We kind of have it all laid out for them to help them out. We tell them it's like brushing your teeth or taking your medicine. Those are not things you would skip during the day, hopefully, and so we don't want you to skip these exercises. And if you don't do the exercises, you can't really expect the kind of success that you would if you did the exercises as part of the program. It does, you know, that's been part of their research, and they've really discovered it can be helpful for patients with multiple sclerosis or patients who've had a stroke, or some of the speech or voice deficits that can happen because of a stroke. And they've even done research in the last 5 to 10 years with children, and they're seeing some really good outcomes with children with cerebral palsy or children with Down syndrome. Well, in the speech pathology department, we offer the LSVT LOUD, and we have clinicians here that are certified and trained to provide that 5 days a week. We work with the occupational therapy department, and those clinicians can provide LSVT big. So in LOUD, we work on a loud voice, sort of over accentuating your voice being maybe bigger, but we say loud. And in occupational therapy, they work on big movements, reaching farther, stepping larger. And so they work really well together. It's hard for some people to commit to that 4 times a week for 4 weeks. You know, we do see Parkinson's in patients who are younger and younger these days, and some of them are still working full time, and so that 4 times a week can be really difficult. So we would offer some alternatives to that LSVT LOUD, like traditional speech therapy. So that's typically twice a week, you know, and we kind of go 4 to 6 weeks and see how we're doing and reassess and see if we need to continue. We do offer another program called Speak Out, and that's another speech voice program that was designed for patients with Parkinson's disease. It doesn't have quite the intensity of the LSVT LOUD, but the same sort of idea of being louder. Their mantra is speak with intent. Speak Out, I work with the patients to be intentional in everything they say, whether it's little comments or speaking at work or to family or on the phone. You know, I always tell my patients what you have to say is just as important as what everybody else has to say, but you just have to work a little harder to be heard. The one thing that I see the most that really makes me feel good is where I feel like my patients are having success. We have a lot of patients who have grown children who maybe don't live in the area and they miss their grandkids. They don't get to see their grandkids or their children very often. And when they can tell me that, you know, I talked to my daughter on the phone and she said, "Wow, Mom, I could really hear you today." I think that just speaks volumes for what this program has to offer.